back. Major medical groups are now responding to the Trump administration's warning against taking Tylenol while pregnant. Yesterday, President Trump and other health officials announced acetaminophen may be linked to a risk of autism. At least 10 health organizations, including the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics, are pushing back on that warning, saying acetaminophen crucially helps lower fevers, which, if gone untreated, can end pregnancies.
The president's announcement of a link between prenatal Tylenol use and autism has got a lot of medical professionals talking. Joining us now is Dr. Brandon Crawford with the Neurosolution Center of Austin. His office focuses on combining neuroscience and technology to treat neurological conditions in patients of all ages. Dr. Crawford, thank you so much for joining us.
Thank you for having me. I'm very excited to talk about this.
Great. Well, let's begin with some general observations. In your experience, what have studies shown about the use of acetaminophen during pregnancy and the diagnoses of autism spectrum disorder or other neurological conditions?
Sure. Well, I think I'll start by saying that I'm very grateful for the steps that are being taken, right? This has been a long time coming. As a provider that's been in this space for about 16 years, we all have been asking the questions, what is really causing this dramatic rise of neurodevelopmental disorders? So what we now see in what's been presented to us as of yesterday is that there is this correlation between taking acetaminophen or Tylenol while pregnant, and then even, if you give this Tylenol to a baby, that it does correlate with neurodevelopmental disorders like autism and ADHD. I will point out that correlation does not necessarily equal causation. Okay, but what it does point to is one of many factors that we have now uncovered. Okay, when we're working with patients, we always tell them autism or whatever neurodevelopmental disorder we're working through is multifactorial. And whenever this initiative began, this is how I saw this playing out, that we would see the uncovering of these factors slowly as the data presented themselves, right? So now we have this data point. It's great. I love it. But what does it mean? Right. Well, we know that when we take Tylenol, it does actually deplete our glutathione stores. Well, why is that so important? Well, glutathione is our master antioxidant. It protects us. It protects our brain, protects our cells, protects our nervous system. It's very important, especially for the developing brain. You really need to be working with your provider. I think that especially if you're pregnant, you need to be communicating with your provider, because maybe acetaminophen is not the best option whenever you have some type of ache or pain or something like that. It might actually be pointing to the need, maybe you need some manual therapy. Maybe you should pursue massage therapy. Maybe you should pursue chiropractic care, physical therapy, something, right? Maybe it's pointing to a problem that needs a different solution than just swallowing a pill, right?
So with all this new information, what do parents need to know about interpreting these findings?
Well, they need to understand not to panic, right? Again, this is one data point. This is one factor, okay? There was a lot of discussion about, don't take Tylenol ever, and, this is a huge problem, and we've found the answer and all these things. This is not the answer. This is one of many factors that will continue to uncover, right?
Got a lot more information, a lot of confusion, but like you said, consult with your medical provider if you have any questions. Dr. Brandon Crawford with the Neurosolution Center of Austin, thank you so much for joining us.
Thank you.